KPVI News at 5. News that works for you.
And today we take the next step to repeal and replace Obamacare.
President Donald Trump is celebrating a legislative victory today with a vote to repeal and replace Obamacare. Good evening. Thanks for watching tonight. I'm Matt Davenport. Breaking news: in a dramatic vote, the House of Representatives passed a new health care bill this afternoon. The health care measure passed by a narrow margin of 217 to 213 with no Democratic support. It marks a major turnabout from 2 months ago when House GOP leaders called off a first attempt to pass a health bill when they failed to round up enough votes. But this is just step one. The bill now moves to the Senate, where significant changes in legislation are almost certain. KPVI News that works for you reporter Deanne Coffin has been working to find out how this may affect Eastern Idahoans. She joins us now live in the newsroom. Deanne.
Matt, I met up with a financial advisor who helps people get signed up for insurance and someone who suffers from a costly medical condition and needs insurance to keep up on his treatments. The House of Representatives voted to repeal and replace the Affordable Care Act and provisions. If this bill becomes law, it would affect people like Sean Ennis of Pocatello. He depends on treatments for his sleep apnea condition. He had health insurance through his parents, but lost those when he turned 26. And under the Affordable Care Act, can no longer have coverage under his parents' plan.
To see a sleep specialist is hundreds of dollars a visit. It's $1,000 a night, at least, to do a sleep study, to check if the equipment's working, to see how you're breathing, what's going on. And then you have the machine itself, you're looking at it at least, $1,500 going up. So without that health insurance, that's very expensive.
Ironically enough, he just got a job selling health insurance.
If it wasn't for the new job I've just started, I'd have to go and use the subsidy.
This bill, which would dramatically change the way the federal government funds individual health plans and Medicaid, is expected to dramatically increase the number of people without health insurance if this law is enacted.
If you're an individual person, this repeal of the Affordable Care Act, what it's intended to do is do away with subsidies. And that is a pretty big deal, because that means that if you're an individual and you are between 100 and 400% of the federal poverty level, you could potentially receive a subsidy to help pay for your health care. And that would go away and be replaced with a tax credit.
According to the Wall Street Journal, a last-minute amendment from Representative Fred Upton from Michigan added $8 billion in spending over 5 years to increase protections for those with pre-existing conditions. If the bill passes the Senate and the president signs it, the bill will go into effect in 2018. Reporting live from the newsroom, I'm Deanne Coffin, KPVI News that works for you.